Hey everyone, and welcome back to Sensorium Insight. I'm Syed Umair, your host, and today we are diving into the world of mental health. So get ready, because we are about to unravel some important and relatable stuff. Let's face it, the phrase mental health can sometimes feel as confusing as trying to put together IKEA furniture without the instructions. You know it is important, you know it should make sense, but somehow it feels overwhelming. That's where I come in. Today we'll break down what mental health really means, what it doesn't, and we'll also answer the age-old question, what's the difference between a psychiatrist and a psychologist? Spoiler alert, one of us can prescribe meds, the other can help you figure out why you keep assembling life's emotional IKEA bookshelves upside down. So sit back, grab a snack, and let's dive into the fascinating world of your mind. Now, here's where a lot of people get confused. Mental health is not the same as mental illness. Let me explain it like this. Just because someone doesn't have a physical illness doesn't mean they're in perfect physical health, right? You can be out of shape, tired, or stressed without having the flu. It's the same with mental health. You can be struggling, feeling overwhelmed, or anxious without having a diagnosed mental illness. On the flip side, someone with a mental illness like depression or anxiety can still have days where they feel good and function well. It's all about managing it. As famous psychiatrist Sigmund Freud once said, one of your vulnerabilities will become your strength. And that's what managing mental health is all about, acknowledging your struggles and finding ways to cope, grow, and thrive. Now for the million-dollar question. What is the difference between a psychologist and a psychiatrist? Well, both are focused on understanding the mind, but in very different ways. Think of it like this. A psychiatrist is like a mechanic for your brain. We've been through medical school, so we can prescribe medication to help you get those mental gears turning smoothly. We focus on the biological and chemical aspects of mental health. If you're having trouble with severe conditions like schizophrenia or bipolar disorder, a psychiatrist is your go-to person. A psychologist, on the other hand, is more like your mental personal trainer. They have a PhD or a PsyD and specialize in therapy and behavioral interventions. They can't prescribe medications, but they will help you work through issues using techniques like cognitive behavioral therapy if you want to change patterns of your thought or behavior. A psychologist is the one you'll want on your team. Fun fact. There are over 180 different types of therapy that psychologists use. So if one approach does not work, there are plenty of others to try. It's like finding the right pair of shoes. Sometimes you just have to try a few before you find the perfect fit. Alright, it's time to bust some myths about mental health. These misconceptions are not just frustrating, they can be downright harmful. So let's tackle a few of the big ones now, and we'll tackle more as we go along in further episodes. So myth number 1, mental health problems are a sign of weakness. The truth is, mental health struggles have absolutely nothing to do with strength or weakness. Just like no one blames you for catching the flu, no one should blame you for dealing with mental health issues. Sometimes it's genetic. Myth number 2, therapy is only for people with serious problems. Therapy isn't just for when your life feels like a soap opera. It is for anyone who wants to understand themselves better, cope with stress, or navigate life's challenges. Think of it like a mental tune-up. Sometimes you just need to talk things out before they snowball. Myth number 3. People with mental illness can't work or live normal lives. Many people with mental illnesses are highly functioning with successful careers, families, and fulfilling lives. With the right treatment and support, people with mental health conditions can thrive just like anyone managing a chronic physical condition. Myth number 4. Mental health issues are rare. Actually, they are incredibly common. According to the WHO, 1 in 4 people will experience some form of mental health issue in their lifetime. So if you feel like you are alone and the only one struggling, you are definitely not. Myth number 5. You just need to think positive and it will go away. I wish it were that easy. Positive thinking can help, but it is not a cure. Telling someone to just cheer up is like telling someone with a broken leg to walk it off. Mental health issues often need a combination of therapy, medication, and support, not just optimism. Myth number 6: children don't experience mental health problems. Children can absolutely experience mental health challenges. In fact, half of all mental health conditions start by age 14. The sooner we recognize the signs and intervene, the better the outcome. Kids might not always have the words to express what they're going through, but their feelings and experiences are just as real. Myth number 7: medication will change who I am. Medication does not change who you are. It helps you become who you are without the interference of mental health struggles. It is like wearing glasses to see clearly. It doesn't change your personality, it just helps you navigate the world more effectively. As Carl Jung once said, I am not what happened to me, I am who or what I choose to become. And that is why it is so important to take control of your mental health despite these common misconceptions. Now that we have debunked some common myths, let's dive into a topic that often gets misunderstood: psychiatric illnesses. These are medical conditions that affect your mood, thinking, and behavior. And no, they are not just in your head. They are real medical conditions that can be diagnosed and treated, just like diabetes or high blood pressure. Let's break down some of the most common psychiatric illnesses. I'll give you a superficial rundown, a bit of a crash course, and we'll dive deeper into each mental illness further along in the future episodes. So, let's start with depression. Depression is more than just feeling sad or going through a rough patch. It is a persistent feeling of sadness, emptiness, or hopelessness that can last for weeks, months, or even years. People with depression often lose interest in activities they once enjoyed, have trouble sleeping or concentrating, and may even experience physical symptoms like fatigue or aches. It is one of the most common psychiatric illnesses globally, affecting about 264 million people. Anxiety disorders. While it is normal to feel anxious sometimes, anxiety disorders involve intense, excessive, and prolonged worry that can interfere with daily activities. There are different types of anxiety disorders like generalized anxiety disorder, panic disorder, and social anxiety disorder. It is like your brain is constantly stuck in fight or flight mode, even when there's no real threat. Bipolar disorder. This is a mood disorder characterized by extreme highs, which are called mania, and lows, which is depression. During manic episodes, people may feel euphoric, full of energy, and sometimes engage in risky behavior. During depressive episodes, they may feel intensely sad, tired, and unmotivated. Bipolar disorder can be challenging, but with the right treatment, people can manage their symptoms and lead full, productive lives. Schizophrenia. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, experiencing hallucinations, delusions, and disorganized thinking. Despite common misconceptions, schizophrenia does not mean having a split personality. It affects about 1 in 100 people worldwide and can be managed with medication and therapy. Obsessive compulsive disorder, OCD. OCD involves unwanted intrusive thoughts, which is obsessions, and repetitive behaviors or mental acts, which is your compulsion, aimed at reducing the anxiety caused by those thoughts. For example, someone might wash their hands repeatedly because they are terrified of germs, even when they know it is irrational. OCD can take over someone's life, but treatment can help regain control. The obsessions in OCD could be almost anything, and that is what interests me so much about OCD, because I have gotten to see so many bizarre obsessions that I never even realized could be an obsession. And the way they had to cope with those obsessions would completely ruin their lives. And then you had to figure out a way to manage those patients. So OCD is a very interesting topic, and we'll get to talk more about it later on. Next is post-traumatic stress disorder, PTSD. PTSD can develop after someone experiences or witnesses a traumatic event, like a natural disaster, accident, or violence. People with PTSD may experience flashbacks, nightmares, and severe anxiety related to the event, often feeling like they are reliving it over and over again. While PTSD is commonly associated with military veterans, anyone can develop it after trauma, including children. Interesting fact. Did you know that 1 in 8 people globally live with a mental health disorder? That is about 970 million people. Yet mental health services are often underfunded and under-resourced, especially in low-income countries. It is important to remember that psychiatric illnesses are just that, illnesses. They are not something you can just snap out of or just get over. But the good news is, with the right treatment, people with psychiatric conditions can lead happy, fulfilling lives. Treatment might include therapy, medication, lifestyle changes, or a combination of all three. And just like with physical health, early intervention is key. Now, I'll be honest with you. When I first started in psychiatry, I was skeptical about medication. I thought therapy alone should be enough for most patients. I didn't fully believe in the power of medications to treat psychiatric illnesses. But after spending time with patients and seeing firsthand how they struggled with their symptoms, I started to see something remarkable. When patients began taking the right medications, their lives changed. I saw people who couldn't get out of bed because of depression suddenly finding joy again. I witnessed individuals with severe anxiety who hadn't been able to leave their homes for months slowly reclaim their independence. Schizophrenia patients, once consumed by delusions, were able to reconnect with reality and function in ways they hadn't for years. The transformation was undeniable. It wasn't about dulling emotions or numbing patients, as I had once thought. It was about restoring balance in their brain, giving people the ability to live their lives again. Medication, in combination with therapy, became a powerful tool for healing. And that's when I realized just how effective and life-changing psychiatric medications can be. Medications aren't for everyone, and they're not always the whole answer, but for many, they are a vital part of treatment. They help people regain control and start living again, rather than just surviving. So while I didn't believe in medications at first, I've seen the profound impact they have on patients' lives. I now fully appreciate the balance between therapy and medication in helping people achieve mental wellness. Let's talk about the importance of early intervention. Did you know that 50% of mental health conditions begin by the age of 14, but most cases go undiagnosed for years? The sooner someone gets help, the better the outcome. It is like catching a small fire before it turns into a full-blown wildfire. Recognizing the signs early, like changes in mood, loss of interest, or isolation, can make a huge difference. Don't wait for things to spiral. And remember, reaching out for help doesn't mean you are failing, it means you are taking control. Studies show that early intervention can reduce the need for long-term treatment by up to 50%. So getting help early on can actually save you a lot of time and stress in the long run. And that is one of the objectives of this podcast. And something I want to try to do is educate more people in the community that are not necessarily doctors or psychiatrists or psychologists, just normal people with different jobs, to be able to catch these early signs and symptoms of their own, or maybe a relative or a friend or someone they work with, so that they could get their help on time, and so that it doesn't get worse or more severe. Last but definitely not least, let us talk about prioritizing your mental health. Self-care doesn't have to be expensive spa days or fancy retreats. It is the little things that add up, like getting enough sleep, moving your body, staying connected with friends and family, and even doing something as simple as taking a break when you need it. As the saying goes, you can't pour from an empty cup. Take care of yourself so you can be there for others. And hey, it is okay to take a mental health day. It is better than pushing through and burning out. So that's that for today's episode of Sensorium Insight. I hope you learned something new about mental health and maybe even had some interesting, provoking thoughts. Remember, taking care of your mental health is just as important as taking care of your physical health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who might benefit from these discussions. And as always, if you have any questions or topics you want to hear about, reach out to me on social media. I'm your host, Sayed Umair, and this is Sensorium Insight. Take care, and I will see you in the next episode.